African region. First, some housekeeping. We have interpretation in English and French. You can go to the bottom right-hand corner of your screen, click on the globe icon, and select your most preferred language. Let me now introduce our panelists for today. We have Dr. Egas Emon joining us from the WHO Emergency Hub in Nairobi. He is the acting incident manager for the Greater Horn of Africa food insecurity and health crisis. Then joining us from Juba, South Sudan is Dr. John Rumunu. He is the Director General of Preventive Services, Ministry of Health, South Sudan. We have from Ministry of Health, Uganda, Lieutenant Colonel Dr. Henry Bossa. He is the incident commander for the Ebola outbreak in Uganda. And from the WHO Regional Office for Africa, we have our regional incident manager, Dr. Patrick Otin. A warm welcome to you all. Before we turn to our panelists, I would like to set the scene by giving us the result of the analysis, which finds that climate-related emergencies in the region has jumped by 30% between 2011 and 2021. In 2021, it accounted for 72% of all recorded public health events that have been substantiated. This is an increase from 58% in 2011. One major climate-related health emergency is the ongoing drought in the Greater Horn of Africa. I would like now to turn to Dr. Egmont Evers, who will be talking to us about the impact of the drought on the health of the people in the region. Welcome, Dr. Evers.
Thank you, Dr. Mary, and good afternoon, colleagues from Nairobi. Thank you for the introduction. Ahead of the COP, indeed, this is a very timely moment to talk about this major climate-related emergency that's going on in the Greater Horn of Africa. Currently, we have 47 million people expected to be facing crisis levels of food insecurity. This is due to the worst drought in 40 years in the region. Currently, we're experiencing the fifth failed rainy season, while at the same time, South Sudan and Sudan are experiencing very severe floods, and we'll hear more about that from other colleagues on the panel. And also Ethiopia and other places, conflict is causing some of the food insecurity. The main message that we want to convey as WHO is that the food insecurity crisis is also a health crisis. Often people, when they think of what's needed in the Horn of Africa, they rightly think of food, clean water, livelihoods, and indeed they are essential, but at the same time, the health impacts of the crisis are huge. Malnourished people become sick more easily, and sick people become malnourished more easily. The outcomes when disease and malnutrition are combined are worse. We know this about the combination of cholera and malnutrition, measles and malnutrition, common childhood diseases and malnutrition. There's more severe disease and more death. We know globally already that 45% of all child deaths are linked to malnutrition. Food insecurity also means that people are on the move. Already the region has 18 million refugees and internally displaced people, and the numbers continue to rise. Displacement means interruption of life-saving healthcare, such as immunization, maternal and childcare, but also increased risks, such as poor water and sanitation, overcrowding, malnutrition, risky coping behaviors, and loss of livelihoods. As you mentioned, Dr. Mary, the analysis from our colleagues in Brazzaville has shown that indeed there are 39 acute public health events. This year, the highest number, 1,000, was still 2 months to go in the year. We're seeing that these public health events are becoming more common, and the combination with increasing food insecurity and malnutrition means that they will also be more deadly. At the same time, we also know that there are severe interruptions in health service delivery, meaning that there is diminished capacity to provide services exactly when they're needed the most. As WHO, we're responding with millions of dollars worth of life-saving medicines, we're conducting vaccination campaigns, training thousands of healthcare workers to treat severe acute malnutrition with medical complications. In several countries, we have community health workers going door to door, providing commodities, sharing crucial health information, and collecting information on disease and deaths. Across all of the countries, we're investing in surveillance, disease surveillance, but crucially also nutritional surveillance, mortality surveillance, where this does not exist, and it does not exist in most of the countries of the Greater Horn of Africa. This is essential to make sure that we make the best use of the limited resources that we have. We've asked for $124 million as WHO for 6 months across the 7 countries of the Greater Horn of Africa, but we've managed to find only 1/3 of that. And that means very plainly that there will be life-saving interventions that will not happen. Thank you, Dr. Mary. Back over to you.
Thank you very much, Dr. Egas, for that elaborate updates on the crisis in the Horn of Africa. Now we will be turning to Dr. John Rumunu to hear about the flooding in South Sudan. Please tell us how the country is responding to this crisis. Dr. Rumunu, please.
Yeah, thank you very much for giving me the floor. South Sudan is facing its first consecutive severe flooding season this year, 2022, after the flooding in the last 3 years. This is one of the main drivers of humanitarian needs in the country, besides recurrent conflict, as you know. The flooding has affected over 1 million people across 37 out of 80 counties, including Abyei administration.
Dr. Rumunu, you're muted, please. Dr. Rumunu, can you unmute yourself? Yes, please.
Oh, sorry. South Sudan is facing the first consecutive severe flooding season in this year, 2022, after having had flooding in the last 3 years. This is one of the main drivers of humanitarian needs in the country, besides the recurrent conflict. The flooding has affected over 1 million people across 37 counties of the 80 counties in the country. This includes Abyei administrative area. 4 states, Northern Bahr Ghazal states, Warab, Upper Nile, and Unity states out of the 10 states are the top most affected states, accounting for almost 3/4 of the affected population. The impact of this severe flooding include direct toll on human lives. Recorded data shows that there are 62 deaths due to drowning, trauma, or injuries, and snake bites. There is increased cases of snake bite reported from flooded areas. Also, there is impact on health services, like there are 45 health facilities, 25 nutrition facilities, an unknown number of boreholes have been affected, either submerged, cut off, or structural damage are sustained. Also, there is increased caseload of diseases like malaria, diarrheal diseases, respiratory tract infection, and so forth. There is depletion of essential drugs supplies in health facilities owing to increased needs and demands. The Ministry of Health, with support from health partners, are responding through coordination at national and state levels, through EPNR and health cluster coordination forums to guide efficient utilization and prioritization of available resources. There is also provision of emergency supplies including snake antivenom, interagency emergency health kits, reproductive health kits, severe acute malnutrition kits, and so forth. We are also taking distribution of malaria commodities, including drugs and diagnostics. There is distribution of mosquito nets. There is preemptive oral cholera vaccination campaign, which we conducted in cholera hotspot areas and flood-prone areas this year. 3 rounds of hepatitis E virus vaccination also has been conducted in Bentiu, one of the largest IDP camps in the country. And we are also enhancing surveillance and outbreak detection and investigation. We have challenges, which includes limited availability of essential supplies, logistical challenges, impacted access to flood-affected location, interruption of care for chronic communicable and non-communicable diseases, including lack of implementation of some preventive and control measures for malaria, as well as optimal scaling and timely distribution of mosquito nets ahead of rainy season. Thank you very much.
Thank you very much, Dr. Romuno. And now to you, Lieutenant Colonel Dr. Henry Bosa. Please tell us the latest on the Ebola outbreak in Uganda.
Thank you so much, Mary, and thank you so much, colleagues. We are in the 7th week of the Ebola response in Uganda, which was declared on the 20th September. That started in a district called Mubende, 3 hours from Kampala. And that currently remains the epicenter of transmission, and the neighboring district of Kasanda. These are adjacent districts of 600,000 individuals and 300 individuals. And 3 weeks ago, government placed a lockdown on these districts, coming out of the fact that cases are actually infected individuals were moving to the city. And by then we had 3 confirmed cases moving to Kampala. And since then, the government has been able to, government and the Ministry of Health, with support of partners, been able to nip the 3 clusters. We've been able to identify all the contacts, nearly all the contacts, and quarantining them. We have had secondary transmissions arising out of these incursions, and most of them have been admitted in Entebbe. We are making sure that there's no silent transmissions going on or potentially missed cases. We are doing a mortality surveillance to the extent that all deaths in Kampala and the surrounding districts around the city, making sure that we test all bodies for Ebola so that we don't miss any transmission that is going on. So I would say, as we speak now, the cases, the total case count stands at 131 with the 48 deaths. Currently managing the patients both at the epicenter and those that are coming from the Kampala metropolitan area in the areas of Entebbe. Thank you.
Thank you very much, Lieutenant Colonel Dr. Bosa, for that update on Ebola outbreak in Uganda. Now I will turn to you, Dr. Patrick Oting. As we have said earlier, that climate-related emergencies are increasing in our region, and disease outbreaks are also on the rise. What about Ebola? Are we seeing an increase in outbreaks? And do you think there is a link between Ebola outbreaks and climate change?
Thank you, Dr. Mary, and good morning, good afternoon to journalists joining us. To the first part of your question, Dr. Mary, yes, we have seen an increase in the number of Ebola outbreaks in our region. Since 2000, the year 2000, we have had 32 outbreaks of Ebola. And this outbreak, if you try to separate the time period they have happened, in the last decade, we have had 19 outbreaks. The preceding decade, we had 10 outbreaks. So we have had more than 50% increase in the number of Ebola outbreaks that are being reported in the last decade. But also it's important to note that out of those 19 reported in the last 10 years, there have been 10 of them, which is more than 50% occurring in the last 5 years. So we have seen an increase in the number of outbreaks that have been detected in the region. Now, Ebola is one of the zoonotic diseases. By zoonotic diseases, we mean these are diseases that start in animals, and then there's a spillover or a jump to humans. And there are many of them. There are many zoonotic diseases. So I'll only focus on the Ebola for now. So there are a number of zoonotic outbreaks that have been occurring, and we've also seen more than 63% increase in the number of zoonotic diseases occurring in the region in the last decade. So if we are to say, is there a direct link between the increase in Ebola and the wider family of zoonotic diseases with the environment and climatic changes that we are seeing? There have been a couple of researches that have shown a possible link between the climatic changes that we are seeing and the increase in zoonotic diseases, and for this particular case for Ebola, for instance. And one of the things that was being given, as we know, disease causation is a multifactorial event. There are so many factors that contribute. But if you look at Ebola in particular, the human factor is there. We are seeing that the population is increasing. There's increasing urbanization, and people are encroaching into the habitats of the wildlife. And there's therefore increased interaction between human and the wild, which facilitates the jump of the viruses from the zoonotic sources to humans. But also when we look at the climatic factor and the climate change, so changes in temperature and changes in climatic condition also results in migration and movement of some of the hosts of the Ebola virus. And for the Ebola virus, we know that the bats and other animals are hosts of this particular virus. So when they move from areas where, for instance, there is drought, or whether areas that are no longer conducive for them, and they move to favorable areas, they may move into an area where the human population are habiting, and therefore the interaction between the humans increases. So it therefore leads to increased frequency of Ebola outbreaks in the region. Now, finally, I would like to comment briefly on the Ebola outbreak, and my brother, Dr. Chobe, has mentioned the number of cases, but I also wanted to emphasize the number of cases and deaths. I also wanted to emphasize the fact that we have seen an increase in the number of people who have been treated and they have survived. So far we have 43 individuals that have been treated in the treatment centers in Mubende and in Entebbe who have survived. This points to two facts. One is that the supportive care that is being given by the healthcare workers is really helping, and people are able to recover. And also the fact that we have to acknowledge the sacrifice and the dedication of the frontline healthcare workers who are really putting in all their efforts to ensure that around the clock, they care for the patients that are at their disposal. So I would really like to end with an appeal to all the people in Uganda, and particularly those who would think that they have symptoms suggestive of Ebola, that they present themselves to a health facility early so that they can be able to be supported and their chances of survival increases. Thank you, Dr. Mary.
Thank you very much, Dr. Otim, for that update. Yes, with early reporting, we have better chances of survival. So now that you have heard from all our speakers, it's your turn to ask your question. To do this, please use the Q&A function on the Zoom platform. Tell us your name, the name of the media organization you represent. And if you like to go live, please indicate in the platform and also by raising your hands. So on hand to answer questions, we have additional experts. First, we have Dr. Etienne Kwa, who is the emergency manager for health information and risk assessment. And then we have Dr. Kone Brahma, who is the technical officer on climate change. So right now, I would like to start with a question from Chukuma. While you get ready to ask your questions, what are the implications of climate-related health emergencies in the Greater Horn of Africa, as well as Uganda, as well as Ebola in Uganda? And I think he's also asking about the implications of the outbreak for Nigeria. So I will ask first Dr. Evers to address this question, and then other panelists could complement as well. Dr. Evers, please.
Thank you. So the implication of the climate-related health emergencies, meaning the droughts and the flooding in the Greater Horn of Africa, and the resulting food insecurity, I think that they're very, very severe. We know that, as I mentioned, when there is a combination of malnutrition with these increased outbreaks that we have, that there are more severe cases and that there is, as a result, more death. We know also that when there are interruptions to livelihoods, when there is food insecurity, that means that people will move. And that kind of migration, that kind of displacement also has inevitably health consequences. We know that results in poorer wash conditions, more risks for communicable disease, overcrowding, malnutrition, also as a result of this displacement, sometimes risky coping behaviors, and loss of livelihoods. I hope that helps to answer the question. Over to you, Dr. Mary.
Yes, thank you, Dr. Evers. Dr. Otim, do you want to complement and the potential risks as well of Ebola in other countries?
Thank you, Dr. Mary. For the Ebola outbreak in Uganda, we carried out a risk assessment, and we are actually in the process of revising the risk assessment based on population movement mapping that was done. For now, the highest risk remains at the national level in Uganda. We've seen that because of the regional connectivity and the movement and the socio-cultural linkages among the countries in East Africa, there is a moderate risk of spread to the 6 countries that are directly neighboring Uganda. The rest of the countries in Africa that include Nigeria and all the other, the rest of the world, the risk of the spread is low. There have been measures instituted within Uganda to ensure that we mitigate any risk of exportation of the disease. There is exit screening happening at the Entebbe International Airport and other major ground crossings as is required under the international health regulation. And as Dr. Chobe had mentioned, there was restrictions placed on the movement of people from the epicenter, but also on any person that has been listed as a contact so that they do not leave the country. So all measures are being put in place to ensure that to the extent possible, we mitigate any risk of the disease spreading beyond the border of Uganda. Thank you.
Thank you, Dr. Otim. The next question is coming to you, Lieutenant Colonel Dr. Bosa. This question is from Koli from New Vision. What is the final take on lockdown in Uganda, and is it really necessary? You could also complement on this question that we just finished answering if you have anything to add. Over to you, Dr. Henry.
Thanks, Mary. And I think Patrick able dealt with this, the fact that the overall aim, again, to answer the 2 pieces of questions together is that the overall aim of the lockdown was basically to localize the transmission or the response in one area. And that's what exactly the lockdown did. And we've been so far successful because we had started seeing individuals moving out of these areas, coming to the cities. The challenge, maybe to bring this into context, fighting Ebola in densely populated areas is quite challenging and very, very difficult. So for us having this lockdown, actually, for this limited lockdown, actually averted lots of things which we are seeing. Again, as Patrick said, again, we are making sure that we don't have anyone living in the country, and anyone who is a contact is on a no-fly list. And this is shared with immigration at all crossings and international borders. But more importantly, the effects of the lockdown so far is actually being felt, because since the lockdown coming now to 3 weeks ago, we've not been able to see additional cases coming to Kampala. And the 3 clusters that we've been following, we've been able to limit secondary transmission, much as we've had some secondary transmission, but we've been able to limit it because we are dealing with a fewer clusters. The effect, if you had several individuals moving out of the epicenter coming through, would have created a situation of diffuse transmission in densely populated parts of the city, making the response very, very difficult. Thank you.
Thank you very much, Lieutenant Colonel Dr. Henry Bosa. Daniel Moore from the business, I understand you would like to go live with your question. Are you ready?
Yes, can you hear me?
Yes, we can hear you. Go ahead, please.
That's great. So a question for Dr. Evers, but also to any of the other experts who might like to answer. Do you consider what's happening in the Horn of Africa now, the drought and famine, to be a direct consequence of climate change and an example of climate change in the here and now? And with the COP27 conference starting next week, can I ask you, with your experience on the ground of what's happening in the Horn of Africa, what's your message to the conference about addressing climate change and about trying to help both finance and reduce emissions reductions?
Thank you, Daniel. Over to you, Dr. Evers.
Thanks a lot for that question. And indeed, absolutely, this is a climate emergency here and now. What we would like to convey to the COP and to the world leaders who will be attending the COP is that it is really essential to reach agreement on stemming the further rise of temperatures in the meeting that will be taking place from next week. We see that Africa, as the continent that is the least responsible for global warming, is among the first to bear the impact of climate change. So we would like to urgently convey that message to those attending the conference. Thanks.
Thank you, Dr. Evers. Yes, we continue to feel the impact of climate change in our region, and the time to take action is now. So this next question is coming from Sarah Niwe, and the question is coming to you, Lieutenant Colonel Dr. Henry Bosa. How many suspected Ebola cases are there currently in Uganda? How are you supporting contacts of known cases to isolate? And finally, people appear scared of reporting symptoms. How are you tackling concerns and ensuring people are not blamed for having or detecting the virus? Lieutenant Colonel, please.
Thank you so much. We have over 30 suspected cases currently, but the issue about suspected cases is that we have a rapid turnaround. The fact that we have a field laboratory, so we quickly process them and discard them as soon as we have the results coming through. Of course, noting that for the individuals that have early symptoms, we have a prolonged period of up to 72 hours of retaining till when we classify them as cases or no cases. So the number of suspected cases keeps changing from time to time. On the contacts, we have a two approach policy. at the epicenter and then also in the city. In the city, all contacts are quarantined institutionally, and we follow them up for 21 days. At the epicenter, we think because we have a good control on the movements of individuals, a big number of them are self-quarantined in their homes. And again, they're evaluated by our teams on a daily basis for temperature and development of symptoms. So in the city, we make sure that every individual who is listed as a contact is institutionally quarantined and followed up from within our facilities, currently now in Murago. It's true, and I think it speaks to what my colleague Patrick earlier said, that some individuals actually don't report early. They move from one facility to the other, largely private facilities seeking care, and they lose time. And of course, the challenge there is that they present late. But for the individuals that present early and the individuals that where we can have good clinical outcomes, again, as you saw Patrick speaking earlier, that in this outbreak so far, we have reasonably good outcomes, partly because of aggressive treatment, early treatment, but also for the individuals that present early. For the patients that present late, those that have moved from one place to the other, presenting late in the complications phase, when you have multi-organ failure, we have very limited chances of having them pull out. So again, it's some individuals at the beginning were hiding symptoms, moving from one place to the other. And also in the epicenter, we had some pockets of individuals not coming to our facilities early, but this has since changed. Thank you.
Thank you very much, Dr. Henry Bossa. Dr. Patrick Otim, do you want to weigh in on this question?
Yes, thank you, Dr. Mary. I just wanted to add something in terms of the people who are fearing to report. And as we know, Ebola is a disease that invokes a lot of emotions, and people react to it in different ways. And the fact that we have people in the epicenter who have lost people, so there's a lot of mixed feelings at the population level, but there are also some myths and misconceptions that we have had to deal with. So there have been three large prong approach that have been used, both in the epicenter, but also in Kampala. And one has been in terms of directly engaging with the community, listening to their concerns and addressing their questions through the various community engagement interventions supported by the different partners led by UNICEF and supporting the Ministry of Health. The second one has been the use of social anthropologists. Throughout the years of responding to Ebola, we have learned the importance of having social scientists involved in this response, and they are very key in unearthing peculiarities at the community level, community belief systems, and issues that we can help to better get the cooperation of the population. So we had a number of anthropologists from the Makerere University School of Public Health deployed in Mubende and Kasanda, and they have been getting very good analysis from the community level and giving feedback that has helped in reshaping interventions at the district level and also at the national level. The last one is in terms of providing psychosocial support. It's very, very important then that people who have gone through this traumatic experience, those who have recovered, the families that have lost dear ones are supported and are given the mental and psychosocial support that they need. And a number of experts have been deployed on ground to support these families and address the fears that they have, but also really contribute to the reduction of stigmatization, which could be one of the things that's making people fear to report symptoms. Thank you.
Thank you, Dr. Otim. That's a very useful addition to the question. This next question is coming from Uche from the Nigeria Television Authority. I'm going to send this question to you, Dr. Etienne Kwa, and Dr. Patrick Otim, you could prepare to complement. What can Africa do to get rid of recurring zoonotic diseases, such as the Ebola in Uganda? Dr. Etienne, let's have you first, and Dr. Tim could complement.
Thank you so much, Dr. Stefan. This is a very great question. I think as the panelists already alluded to, we know a little bit of what the factors are. Urbanization, we know about land use, or certain levels of climatic hazard that are affecting population and population movements, obviously actually generating more and more outbreaks. And this is already based on research. Of course, there is more analysis on the way to understand a little better. But I will actually start by saying that we need more understanding or better understanding of the interactions between human, animal, and environment, and study the actual pathogens and the vectors and how the transmission are being made. So this is really, I would say, the setup. But what can we really do to prevent or to actually reduce those outbreaks is really to strengthen our surveillance system. So surveillance and detection of the outbreak early enough would actually help a lot, because one way or another we'll have to live, the same environment, and as it was already demonstrated, the pathogen and vectors are going to be strengthened and even increased. But surveillance systems are important for our continent, and we really working hard with in the African region to strengthen what we call the integrated disease surveillance system and response, which actually can provide to everyone data that is needed early enough to see what is really going on the ground, so we can understand what is really coming up, and then get the information of the actions needed early enough to prevent and actually reduce, or in some cases start responding so quickly that it will not expand to more geographic areas where we'll have a little more difficulty to control. So this is what I would say. And in terms of surveillance, it's also a combination of several sources. The focus really has to be more on the community surveillance. You refer to the Ebola case in a situation in Uganda. Obviously, many of these outbreaks start in the community, and we have to find ways to detect them early enough within the community, because we know that patients will not get to the facility until sometime very late. So the community level of surveillance is important, and that actually involves all our communities, our local leaders that are in place on the ground. We also made a reference to a lab by the Lieutenant Colonel. So lab capacity is essential, is important, because we really need quickly to know what we are dealing with, to be able to respond immediately. I will stop here, but these are some of the answers I could provide. Thank you, Dr. Stefan.
Thank you very much, Dr. Etienne Koa. Dr. Patrick or Tim, do you want to comment on what we can do to prevent further zoonotic outbreaks?
Thank you, Dr. Mary, and thanks to Dr. Etienne for ably explaining. I'll just add, I think, 3 more points in terms of what we need to do. As Dr. Etienne has mentioned, it's totally impossible to say we can get rid of the zoonotic diseases, because the viruses are there in the ecosystem and in the environment, and we continue to interact with the environment. But what we can do, we can mitigate, we can further reduce the risk of these outbreaks happening. I think the first one is, in addition to the surveillance that Dr. Etienne has ably explained, is the issue of the multi-sectoral coordination. So one agency cannot do it alone. The Ministry of Health in countries cannot do it alone. It's important to work with the Ministry of Animal Resources or Agriculture, because it's about livelihood of people. The interaction between the people and the wild or even the forests. All this is related to livelihood. So people are doing economic activities and different interventions. So the coordination between the Ministry of Health, the Ministry of Animal Resources or Agriculture, the Ministry of Environment is important. At the global level, WHO coordinates very closely with the World Organization of Animal Health and the Food and Agriculture Organization, FAO, to ensure that we implement what we call the One Health approach in preparing and building capacity and responding to zoonotic diseases. So that coordination of efforts is very, very important. The second one then is working with the communities, because we know that the interaction happens at the community level, and working with the communities to understand the risks, to explain to them the risks, for them to be able to engage in activities that reduces the interaction between the population and the potential hosts of these viruses. Then the third one is, and Dr. Etienne had mentioned this, is around research. And the research is two-pronged. One is to understand the factors and the drivers of the spillover from the wild or from the zoonotic sources. But the other arm of the research is also to develop countermeasures. So one, we have to do surveillance, ecological surveillance, to map out where are the viruses found, which are the potential hosts, which are the kind of viruses that we have out there in circulation. Once we identify these viruses, we can proactively develop vaccines and the therapeutics that, if we have an outbreak, we can quickly respond with an effective vaccine, with the therapeutics that will help to reduce mortality. So it's a combination of this. There is no single silver bullet. It's a combination of all these: the multi-sectoral coordination, the engagement with the communities to involve themselves in sustainable and safe economic activities, and then the surveillance that Etienne has talked about, and the research arm to generate evidence and tools to help us fight. Those are the things that can help us mitigate the impact of zoonotic diseases.
Thank you, Dr. Otin. And this next question is from Alex from Reuters. The question is coming to you, Lieutenant Colonel Dr. Henry Bosa. Could you please repeat the total confirmed cases and confirmed deaths of Ebola in Uganda? I think I heard 131 cases and 48 deaths. Does the Ugandan government still think that the outbreak should be over by the end of this year, as the state communication minister said last month? Or is the outbreak spreading more than what was thought last month? Dr. Henry, please.
Thank you so much. That's correct. The numbers, confirmed cases today, 131 and 48 deaths. On the spread and when we are likely to have the outbreak ending, I see no experts on this panel can actually predict when to end. Not until when we have some parameters which are not yet in our way. But what you're working on is to make sure that we bring this outbreak to a speedy end, or to an abrupt end, through aggressive measures, both at a community level, largely beginning at the community level, ensuring that we have extensive and robust and complete contact tracing, ensuring that we have all the contacts identified and managed according to the protocols, making sure that the population complies with the guidance that we give them, and ensuring that whoever comes to us is treated and managed in an appropriate way, ensuring that we manage all the deaths that die of Ebola in a safe, dignified way. By the way, in the 2 epicenter districts, we are carrying out burial. Government is carrying out burials of all Ebola and non-Ebola cases to ensure that we don't have a potential exposure. So these are some of the things that we are doing, both at the epicenter, but nationally, we are having extensive risk communication for the population. In the center, as I said, in Kampala, make sure that we don't have silent clusters being missed. We test all bodies for Ebola before burial. Across the country, we are having surveillance, VHF surveillance, viral hemorrhagic fever surveillance for all individuals, noting that here we are in Uganda. The early presentation of Ebola is the same way malaria presents, to the extent that hemorrhagic manifestations actually come late and can be missed. So we know, and of course, all our health workers now know, that Ebola is one of the differential diagnoses for all febrile illnesses. And of course, we have a robust sample transportation network from the periphery to the central level to manage the samples coming through and making a diagnosis. Further, for all facilities across the country, we make sure they have a holding facility when a suspect case or a patient suspected to have Ebola is identified by these facilities, is isolated, samples taken off, and managed at that point as though it's Ebola till when we have the samples. So all these measures are concurrently taking place, and we think that I can't place time on anything till actually some parameters are actually being reached. For now, whether end of the year or not, we are working very hard with all the partners, both at the center and the field, to make sure that we do the things that I've spoken about. Thank you.
Thank you very much, Lieutenant Colonel Dr. Henry Bossa. Yes, it's indeed true. Difficult to put a timeline, but as we continue to implement all those measures that we know already do work for Ebola outbreak, we have a good chance to interrupt the transmission quickly. So this next question is coming to you, Dr. Patrick Otim, and the question is from Christina Okelo from RFI. Is WHO concerned that Ebola has now spread to Kampala? What is WHO advising to contain the spread, and how soon will the vaccine be ready? Dr. Otim, please.
Thank you, Dr. Mary, and thanks to Christina for this very important question. As Dr. Chobe had mentioned earlier, Ebola transmission in an urban area is a very complex event to be able to respond to. And whenever you have any imported case into an urban area, you definitely have to get concerned. And we know that the Ugandan government have been concerned and took drastic measures to make it to contain the clusters that came to Kampala. So for now, we feel that with the measures that have been put in place, and if we continue to get the community support and the community cooperation with the response interventions, we should be able to contain the clusters that are in Kampala. But also responding in Kasanda, which has had significant increase in number of cases in the last 7 days, to be able to contain the clusters that are there. So for us, and by IDSR standards, a single case of Ebola is an outbreak, and it's a concern because it's a disease that we have seen, like other viral hemorrhagic fevers. It's highly fatal and it has potential to spread. So our concern can only go down when we have declared the end of the outbreak after 42 days without a case. So we will continue to support the Ugandan government response in all the areas that they require us to work with them in. And I would really at this point want to appreciate the fact that we have worked very closely with the Ugandan government from the beginning of this response on the 20th of September, and we continue to do so to ensure that, as Dr. Chobe had mentioned, we can bring this outbreak to an end as soon as possible. The second part of the question, I have missed to write it down. Dr. Mary, if you're taking it.
Okay, so I think we can move to the next question, given that we just have time, and we have quite a number of questions as well. So thank you, Dr. Otim. I would like to add my voice to you to thank the Ugandan government for their transparency. they have been open with this outbreak right from the beginning. So we do sincerely appreciate it based on the requirements of the international health regulations. So thank you, and thank you for the transparency. So this next question is coming to you, Dr. Rumunu, and Dr. Evers could prepare to comment. It's coming from Rashidat from Radio Nigeria. In view of the flood incidences across Africa recently, what would be your advice to African leaders and how to prevent outbreak of diseases, bearing in mind that water sources have been polluted? So I will start with you, Dr. Rumunu, and Dr. Evers could complement. Dr. Rumunu, you're muted. Yeah.
Thank you very much for the question. As I mentioned earlier, that the flooding has caused increase in diseases like malaria, diarrheal diseases, and respiratory tract infections. So I work for the Ministry of Health, and we are working with our sister line ministry in charge of water resources to ensure that water quality is improved. As Dr. Otim already mentioned, multi-sectoral collaboration is very, very important. We have One Health approach where ministries of health, environment, livestock, and humanitarian affairs and other concerned ministries are working together to ensure that the multi-cluster responses are effective in flood-affected areas. Besides that, for disease-specific control and prevention, as mentioned, we have implemented preventive OCV, that is oral cholera vaccination, and also other vaccination like against hepatitis E. And we are distributing mosquito nets to affected population to prevent malaria, which is actually the most common disease in the area. So we are generally advocating for more resources to support routine service delivery in flood affected and other locations with minimal access to services. So what we would like our government to do is to put more resources in health budget besides what our partners are doing. Thank you.
Thank you very much, Dr. Rumunu. Dr. Evers, please.
Thank you, Dr. Mary. I'll be very brief because I think Dr. Rumunu captured this quite well. We need to make sure that we have a coordinated disease prevention and response, as was mentioned by Dr. Rumunu. The health sector cannot do it alone. We need other sectors to come in as well. We need to make sure that clean water is available for consumption, but also good sanitation to prevent water sources becoming contaminated, as the colleague who asked the question rightly indicated is a problem. We need to ensure also improvements in disease surveillance to respond to outbreaks before they get out of hand, both in facilities and in communities. We also need to make sure that health facilities are able to provide the needed care. Communities need to receive health education where this has not happened so far. And all of this, of course, requires prioritizing investments in public health, as Dr. Rumuna mentioned. Thank you.
Thank you, Dr. Evers. And this next question is coming to you, Lieutenant Colonel Dr. Henry Bosa. The question is coming from Fred from Bloomberg. How much financial package is required to handle the Ebola outbreak in Uganda? And how equipped is the Ministry of Health for this task? How much foreign support has been received and who are the donors? Dr. Henry, please.
Good question. Thanks a lot. It's a tough question to say because much of the support, first the ministry made a budget of a 3-month budget of around 76 billion, and convert this in dollars for international viewers. And within the ministry, we're able to mobilize 20 billion Uganda shillings. I would say there's been a lot of support from partners, but has not been direct support. And this support has been going to different actors. So it's very difficult for me, from the ministry perspective, to know how much the partners have actually injected in the response. But I can confirm that the government of Uganda, within internal resources, so far has been able to inject immediately 20 billion shillings to be able to support the response. And a part of the remaining part of 56 billion is being sought to support the response. Much of the response support coming through partners. As the ministry, we have very little control over that, and it goes direct to the implementing partners. Thank you.
Thank you very much, Lieutenant Colonel Dr. Henry Bosa. And now the next question is coming to you, Dr. Patrick Otim. And this question is coming from Pondwani from Malawi News Agency. Malawi is facing a spate of cholera outbreak, with the first case recorded in March. The off-rainy season outbreak is an uncommon scenario in Malawi. Can this be related to climate change? Dr. Otim?
Thank you, Dr. Mary, and thanks for that interesting question. I think I would like to state 2 facts before I answer the question. One is that Malawi, like some of the other African countries, is really prone to dry spells. They have had seasonal droughts. They have had intense rainfall sometimes, flooding and flash flooding and riverine flooding. So these climatic hazards have been happening in Malawi over the last couple of years. And so before we come to the cholera outbreak that started in March, we take a step back in January, I think January 24th, we had a tropical storm Anna that hit the country and resulted in flooding. And this flooding then that affected mostly the southern part of the country, damaged homes, water systems and latrines, a number of them were damaged. So it is after that impact of the flooding then that we had the first cholera cases being reported in March. And the cholera outbreak has then spread from initially the southern part to the northern part, and I think now most of the districts have been reporting cases. So the initial trigger of this was a climate-related event that disrupted the water and sanitation systems in the country, and then that predisposed the country to have an outbreak. And after that initial outbreak, the movement of people have now resulted in the diffuse transmission across the country. So it's unusual in the country, but usually when you have introduction of an agent like that following a flooding, and then other places where you have other factors that favor the transmission. For instance, we have low access to clean water, like my colleague Dr. Rumun was mentioning earlier, and issues of sanitation. We also know that there have been other predisposing factors in Malawi, like for instance, the malnutrition. Dr. Evers had mentioned earlier vicious circle between malnutrition and cholera, and then cholera and malnutrition. I think there was the integrated phase classification assessment done around February that was showing that in Malawi there are around 4.55 million people that are facing IPC 3 and 4 food crisis in the country. So you have a mixture of factors that have exacerbated the impact of the flood that had happened early in the year. So it's at this point now, it's very, very important that we continue the response so that we can be able to stop the transmission across the country. And there is need for the multi-sectoral, multi-pronged approach that Dr. Rumun was explaining so that we can be able to contain the outbreak. We have been working with the Malawian government on this particular response. And I think the point where we are now, it's very, very critical that we scale up the response and we are able to reverse the epidemiological trend that we have been seeing over the last 3 weeks. Thank you.
Thank you, Dr. Patrick Otim. And this next question is coming to you, Lieutenant Colonel Dr. Henry Bosa. The question is from Lisa Song. She's from ProPublica. Is there an update on specific geographic location of the index case of the Uganda Ebola outbreak?
I think without seemingly rephrasing her question, the index case is the first case we index or the first case we find. But that usually not necessarily the first case in the outbreak, the initial case. So to rephrase her question, I think she's asking about the initial case, not index case. So we think the transmission must have started within the same area, where we trace back and see as far, most likely around August, when the initial cases happened. But pinpointing the initial case for now, no. But we are doing extensive work to be able to piece together and see where the initial breach from the wilds must have come from. That usually takes a bit of time, but you're moving in that direction. So the answer is we have the index case that was confirmed on the 19th, but we know we may have had the initial cases or initial case that may have happened a little earlier. Thank you.
Thank you very much, Dr. Bosa. And this question is coming to you, Dr. Patrick Otim. Is from Hudson Kutesa, the New Times, Rwanda. What is WHO currently doing to support countries like Rwanda in their effort to prevent Ebola virus or respond to it in the event that the outbreak scenario shows up in a given country? Dr. Otim?
Thank you, Dr. Mary, and thanks to, I don't know, Fusum, I got the name correctly for that very, very important question. So the readiness in the neighboring countries, in the countries neighboring Uganda, has been a priority to us. So from the moment that the outbreak was declared on the 20th of September, we did the rapid risk assessment and mapped out the countries that are priority, and Rwanda was identified as a priority 1 country. And we have been then working with these countries to be able to get them ready. The first thing we did, we have a standard WHO readiness for Ebola checklist that was distributed to the countries, and the countries assessed their capacity. And Rwanda assessed the capacity. I think it was fairly well in a number of the pillars that we look at. There were gaps that they identified, and then they developed a contingency plan along with other countries to address the gaps that they had identified in their status of readiness. They equally developed what we call a 72-hour plan. So the contingency plan is to help them to fix the gaps in their readiness. And then the 72-hour plan is really a rapid response kind of plan that will help in the event that a case is detected quickly to support response for the first 72 hours as you scale up. And then we have been working with Rwanda and other countries to scale up their testing capacity. So Rwanda was one of the first countries that got the testing kits to be able to test for the Sudan Ebola species. And then we supported to supply PPEs from our hub in Nairobi. And currently we are working with them on training. There have been a number of trainings planned on case management, on the laboratory, as well as on surveillance. And they have intensified surveillance activities at the border and also at the airport in Kigali, so that in the last week, they, for instance, activated the digital health declaration form, so that any healthcare, any traveler that comes who have been in Uganda, they are able to follow them up just as out of an abundance of caution, by sending digital prompts, messages that they can respond and say, I'm okay, I do not have any symptoms, and also educate them on health education. So we are working on the readiness in all these six countries, and we continue to support whenever there is a request that comes from the countries to plug in any gaps, so that they are operationally ready should they detect a case at any place within the country. Thank you.
Thank you so much, Dr. Otim. Yes, readiness is very, very important. All countries need to make sure that they have some capacity to be able to quickly detect and mount an effective response for the outbreak. So we have Zandile from SABC. I understand you would like to go live with your question. Are you ready? Zandile, are you ready with your question? Okay. Looks.
Sorry, doctor, I raised my hand accidentally. Okay. Yeah, I'll drop the hand now.
All right, no problem.
Thank you.
Thank you so much. So we are coming to the end of the press briefing for today. So I'll give 1 minute each to our panelists to give us their final words. You can do it in 30 seconds as well. So I'm going to start with you, Dr. John Rumunu. Your final thoughts or final words, please.
Thank you very much, Mary. I know my topic is flooding, but again, like Patrick or team said, they did, SWHO, they did assessment, risk assessment, and identified some countries as at high risk for importation of EVD from our neighboring Uganda. South Sudan is one of those countries. We are happy that we are getting support from WHO and all the partners in the country, and we are communicating with our neighbors. However, given the long incubation period, our partners are concentrating on the border with Uganda. But the 21 days are enough for someone to travel across the region and enter the country through another border. So I just want to bring that to the attention of our team, that we need more support with the other borders as well. Thank you.
Thank you very much, Dr. Rumunu. And Lieutenant Colonel Dr. Henry Bosa, please, your final thoughts.
Thank you so much. I will speak two things, one for our local viewers here and the international viewers. One, that for the national viewers here, the need for the population understanding the problems that we have, the danger in our midst is very critical. And that places a big responsibility both on government, but also on each individual to be able to follow the SOPs, report cases, and whenever you have symptoms, to report early to the facilities so that we can take good care of you and have you managed. For the international viewers, our aim basically is to bring the outbreak to the speedy end, That's why we have localized the response at the epicenter by restriction of movement. Maybe the word lockdown is big, restriction of movement, because there's a free movement of individuals within the districts, but not outside the district. And this will help us to be able to localize the transmission in one area, which will protect the city, and in essence, will not have a potential of exporting the outbreak beyond the country, including our neighbors, as we had our colleagues from South Sudan, bearing in mind very, very well that we have the virus has a very long incubation period of 21 days, and anything can happen in that period. So both for our national viewers and international viewers, message is we are doing all that we can to make sure that this doesn't spiral out of the way, and make sure that our population works with us. Thanks a lot.
Thank you very much, Lieutenant Colonel Dr. Henry. So I'll go now, Dr. Etienne, Dr. Evers, and Oti, in that order. If you can do it in 30 seconds, it's fine.
Thank you very much, Dr. Stephen-Marie. I would like to thank all the panelists and all the journalists who attended. This has been a very interesting moment to exchange. And as we have mentioned, we know we have to live with the same environment with the pathogens and vectors that we see around us. The pressures, population pressures, urbanization, land use will of course continue to happen, and we will have to deal with the realities, but it's important for us to be prepared. So really being in front, so being prepared, being where we should be in terms of detection of the diseases, in terms of having systems in place to really understand what is going on in our environment will be important. And really, we want to emphasize the need for our countries to invest more in the surveillance systems to really control, be prepared, and avoid more impacts of the climate change that we're all talking about today. Thank you so much.
Thank you. Dr. Evers?
Thank you, Dr. Mary. Thank you, colleagues, for joining today. I'd like to reiterate two points. The first is that the food insecurity in the Horn of Africa, that is a health crisis. As our RD in Afro mentioned, between malnutrition and death, we see disease. We need to make sure to allocate the necessary resources to provide a strong health response to prevent disease and to save lives in the Horn of Africa. And then secondly, to repeat the call to world leaders, we need to reach agreement on stemming the rise in temperatures in the upcoming COP27, which is taking place here in Africa. As a continent, Africa is the least responsible for global warming, but among the first to experience its impact, as we're seeing now in the Horn of Africa. Thank you.
Thank you, Dr. Oti.
Thank you, Dr. Mary. I have three messages to pass. The first one is on the outbreak in Uganda. And I really want to address the people in Uganda that the Ebola is real. And I know in this digital world, there's a lot of misinformation and myths that are being spread. Ebola is real, it's preventable, and we are able to manage cases. Before you decide to abscond and leave, just think of the risk that you're putting to other people. So as the contacts that are embedded in different places, I would really request that they cooperate with the teams, they observe the 21 days of follow-up, and we ensure that we bring this outbreak to an end very, very soon. The second message then to the countries in the region, as we had mentioned, let us continue to build our capacity to enhance readiness so that if the unlikely event that we have any case moving in any direction, there's prompt detection and prompt response as is expected under the international health regulation. The third and last message then, we have looked today at the zoonotic diseases and how they have been increasing over the last decade. It's very, very important then for countries in our region to be able to improve on their surveillance system and build capacities that they can be able to quickly detect and confirm any zoonotic disease, but more importantly, that they're able to put a robust response mechanism that can contain the outbreak at source where it has been detected. Thank you, Dr. Mary.
Thank you very much, Dr. Otim. With this, we have come to the end of the press briefing for today. I would like to say a very big thank you to all our panelists. Thank you to all the journalists. Thank you to the communications team and the interpreters that made this a success. I wish all of us a great COP27 come this Sunday. Thank you so much and do enjoy the rest of your day.
Thank you.
Thank you.